Here we are in the Flagstaff Gardens in Melbourne, Moreton Bay Fig behind us. No panic in the streets here, people enjoying their lunch, lying on the grass, looking at their phones. So I thought I'd do a COVID-19 special, because I'm sick and tired of the garbage that's appearing on social media and most of the legacy media, including the government guild at PIBCI, and I am sick and tired of the response amongst governments at all levels, local, state and federal, and most importantly at all, I'm exceptionally disappointed at the response of a significant proportion of the Australian people, because fear and panic is the last thing you need when you're dealing with a pandemic. Now we're going to go back to the beginnings and we're going to slowly discuss, talk about, extrapolate what threat humanity is currently facing. COVID-19 developed around the end of 2019, the beginning of 2020 in Wuhan province in China. And it's the type of pandemic that the world has been expecting now for some time. With increasing population growth, a climate emergency and diminishing finite resources, we will see pandemics like COVID-19 and much worse be part of the feature of life on the planet. And if you understand the concept of Gaia, which is a theory which revolves around the idea that all the organisms on the planet are interlinked with the planet, and that give and take is necessary, and that if one particular organism like us, we are an organism, we are flesh and blood and bones, reaches a dominant role in society, that other organisms like a virus may mutate or transfer from animals into humans to resolve that issue. I know it sounds very callous and Darwinian, but that's something we need to keep in the back of our minds. Now, I know you find this hard to believe, but outside the ape family, our closest living relatives are the bats and pigs. And it's not unusual for viruses to cross from pigs and bats into the human population. We had the Hendra virus outside Brisbane, which had a 90% mortality rate. We had the swine flu epidemic, which obviously came from swine, pigs, in 2008, which had a devastating effect in certain parts of the world. And now we've got COVID-19. Now, the dilemma initially was we knew nothing about this new virus. So there were two issues facing humanity. One, we knew nothing about the virus. We didn't know how fast it could be transmitted. We didn't know the mortality rate. We didn't know what sections of the population it would affect. And two, because not one human being of the 7.5 billion planet had any immunity against the virus, as a community we were sitting ducks, as a world community we were sitting ducks. Now we've learned a lot of things about this virus over the last 2 months, and I'll go through what we've learned, because I think it's very important to put this in context, because if you put things in context, if you understand something, it gives you the strength and the willpower and the determination to deal with it in a logical, methodical manner. This is not a punishment from God. This is just a virus that's crossed the animal-human boundary. The first thing is, COVID-19 does not have a high mortality rate. The mortality rate in the general population is anywhere between 2 to 3%. The mortality rate in the over 80s is around 8%. The second thing is that children and adults with a normal immune system have the capacity to deal with the virus. In their autoimmune system, they'll catch the virus, they'll deal with it, and it'll be like a minor influenza, and it'll be over in a few days, especially in children. The people who are most at risk are the elderly and people with chronic illnesses, especially people with respiratory illnesses and heavy smokers. These are the people most at risk. So what are the plans that have been put in place, and why have they put in place? A normal epidemic, and I'll talk about the Black Death, the bubonic plague, which swept across the world, especially Europe, in the 13th century. The 14th century. And it's a normal plague. And what happens with a normal plague in a population with no antibodies is it takes off very quickly, a high mortality rate, and then once there is a concept called herd immunity, when a lot of people, the people who have survived, are immune to the virus, it disappears. So that's the normally happens with the plague. And we've had multiple plagues. We've had the influenza virus in 1919, which killed over 50,000 Australians and over 50 million people worldwide. And we've had multiple viruses which come and go. Now, to put it in context, COVID-19 mortality rate is about 3 times more than the normal winter influenza. And we do have vaccination for most of the influenza viruses. Now, so what is the crisis? The crisis is, although we have Medicare, a national health insurance scheme, which means that in Australia we are much better suited to deal with the virus than, say, in America, where it's basically a pay-as-you-go system, health system. What it means is that we have limited resources. Over the last 20 to 30 years, we've seen successive governments trying to destroy Medicare, trying to destroy this universal health insurance scheme, which covers all Australians, irrespective of how rich, how poor, where they come from. So we've got Medicare, which has been underfunded for some time, and a public hospital system which has been underfunded for some time, and we've got a diminishing number of people in the private health insurance industry and a private hospital system which is designed to cherry pick the easy cases so they can actually make a profit. So the dilemma is that if this infection goes out of control in the next few weeks, there'll be tens of thousands of people who will require emergency care. So what happens if the virus attacks somebody like me with comorbidities, who's elderly, or somebody who has multiple health issues? The dilemma is that, I'm just waving to somebody I know over there, it's amazing the people you meet in the park, that's life. So what it means is, your basic problem is not the fever, the fact that you feel like shit, but your basic problem is that you have trouble breathing. Now, if we can sustain people during that period by putting them on ventilators, they will recover in the majority of cases. The dilemma is, in Australia we have 2 dilemmas. One, we don't have enough testing kits, and we are not going to have enough testing kits to test everybody. And 2, more importantly, there are not enough intensive care beds in the country to deal with a mass outbreak. So the whole concept behind self-isolation, behind social distancing, these are nice new terms which we talk about, is based on the idea of trying to flatten. Remember I told you that disease curve goes up and then down. So actually try to flatten the curve so that as people get sick, there are enough medical staff and nursing staff and paramedical staff and enough beds and ventilators to deal with the sick. Because if there's a mass outbreak and there's not enough staff and materials, as we're seeing in Italy currently, and that's why they've got a higher mortality rate than in China, is that what it means is that doctors have to make decisions about who and who will not go on a ventilator. And it basically will be younger people who've got a better chance of recovering than older people who'd be, hogging a ventilator for weeks. So elderly people will then die in greater numbers. So the idea of self-isolation, social distancing, washing your hands is about creating an environment which flattens the curve. Now some countries, like in Holland, it's the only country I know at this stage, is interested in exploring the concept of herd immunity. Now in a normal epidemic which goes up and down, the survivors are immune to the disease because they've developed antibodies. Now in Holland, although there are some restrictions, the government is looking at the concept of allowing young people, hoping that young people will get the disease and create herd immunity in the country. The dilemma of this type of approach is that you can't really have young people who've got the disease working in nursing homes. And in Western society, more and more people are living in gated communities, elderly communities, residential communities, nursing homes. So that is an issue. So the concept is, how do you get herd immunity? You get herd immunity by the majority of people being exposed to the virus and developing antibodies, and there's some people who will die, or you get herd immunity through a vaccination program. And that's why there is this rush to develop a vaccine in record time. And what we are seeing around the world is cooperation from many medical facilities around the world in the development of such a vaccine. So what are the lessons that can be drawn from this? Well, there's been a number of lessons. I think it highlights the inadequacy, the total inadequacy of an economic, social and cultural system which is based on the idea of creating profits from private investments. Capitalist society is designed to maximise profits irrespective of the human, social, environmental and human costs. Capitalism, especially corporate capitalism, is not designed to deal with emergencies. It's about creating ever-increasing profits for a shrinking minority of people. It's not about providing services. So what this pandemic highlights to me is the importance of concepts which anarchists and radical activists have been talking about for decades. Now, Peter Kropotkin was a very famous anarchist scientist at the end of the 19th century, at the beginning of the 20th century, who was instrumental in formulating the Gaia principle. And that's, as I said at the beginning of the program, that's the fact that all life forms are interconnected on planet Earth. There isn't planet B, we only have planet Earth. And he was Darwin's nemesis. Darwin's theories were based on the concept of the survival of the fittest in competition. Peter Kropotkin highlighted that the human race and most other organisms on the planet survive by mutual aid. Now we are at a critical juncture in this country's history. We can continue to be itemised, isolated individuals, hoarding goods, fighting each other, ignoring each other, distancing each other, and hoping at the end of this crisis me and my family and friends will survive. Or we can take a leaf out of the book of many radical activists in the past, and that's the key, that mutual aid, community, providing services that are needed irrespective of the cost to a community. These are the things that are important. As the stock market dissolves, as people panic, as they panic buy, we tend to think that we are the only people that are important on the planet. The reality is that we are in symbiotic relationships with the people around us. You know, if we decided to go on a mass orgy of stealing and killing, there's not enough police or army to stop it. You know? So it's that mutual aid that's important. So at this critical juncture in our history, we should be looking at alternative economic systems, alternative systems of creating wealth, alternative systems of distributing wealth. Things like collectives, cooperatives, having a monetary system which is based on the satisfaction of human needs, not the creation of profits for profit's sake. I mean, that's what we need to look at today in the 21st century. If there's one lesson that can be drawn from this pandemic, is this is a period of opportunity. It's a period of opportunity in terms of raising different issues and raising alternatives to the current economic system, the current political system. Because if there's one group of people that have been found wanting in a disaster, it's government at all levels, local, state and federal. They don't seem to have the capacity or the will to address the fundamental issues regarding how this society is organised. While we continue to worship at the altar of Mammon, we will continue to suffer this. Because we'll get over the COVID-19 crisis, but in 3 years' time or 5 years' time, there'll be another virus as population increases. So we need to have a social and economic system which is based on direct democratic principles, which is based on mutual aid, which is based on cooperation, which is not based on competition and the idea of creating ever-increasing profits irrespective of the consequences to the human race. Now, the great thing about filming this in a park is people will walk up and down, talking away. It'd be interesting to see if we had a real crisis in this country, what would be happening if the mortality rate was 10% or 15% or 20%. Because it doesn't matter how much you isolate yourself at the end of the day, if you don't work cooperatively, you can never deal with issues. So that's the reality we face. And again, the ball is in your court. This is an unparalleled opportunity to get involved in groups and programs which challenge the idea that we live in a society where the mantra is to create profits irrespective of the human cost. I encourage you, as a registered officer of public interest for corporate interest, to look at our website, PIBCI.net. I encourage you to join us as soon as you can. Thank you once again for listening to my thoughts. The important thing is we'll all survive this. Most of us will. I don't think the economy will, and I don't think corporate capitalism will, because I think this is the beginning of the end of us relying on private enterprise, corporations and capitalism to deal with the issues of everyday life and existence. One more thing, not that I want to give unsolicited advice to our beloved Prime Minister Scotty from advertising, but giving money to small business and giving money to people on social security benefits may stave off the inevitable for a week or two. But what we should be looking at is some really radical reforms, like a moratorium on rents and mortgages, both personal and personal debts, for 3 months. Because the big problem is more and more people are going to lose their jobs, is that the economic consequences are going to far outstrip the consequences of the COVID-19. And this is the dilemma that governments face. And giving people money to spend and providing an adequate health system isn't the only solution. They need to make some radical transformations. And the first thing, which I understand the Swiss government is looking at and is starting to implement, is a moratorium on debt, a moratorium on repaying mortgages, a moratorium on paying rents. A second thing you can do is to raise money quickly, a 1% stock market turnover tax, which would raise at least $1 billion every few days, the way the stock market is crashing currently. Another thing you could do is actually freeze wages. There are many public servants like High Court judges and federal judges who are taking 3 to 4 months off and closing courts but are still being paid. Maybe 50% of their income should be directed into the federal treasury as they actually are paid by the state government. As far as corporations are concerned, maybe they should follow Alan Joyce's example of Qantas and forego salaries for the next 3 months and give that money to the federal government in order to deal with the current crisis. So there are many ways we can actually try to minimise the economic consequences on most Australians. But it does mean that those with power and wealth need to make sacrifices. And if they're not willing to make sacrifices, they need to make sacrifices through legislation. Whether our current government is up to it or not, who knows? The other thing is we should have a national government where the opposition and the government and the minor parties form a national government for 3 months to deal solely with this crisis, not just having the premiers in some cabinet meeting, but we need everybody's intelligence, everybody's efforts in order to deal with the situation.